Now it's my pleasure to invite Chris Boone back to the stage, the CEO, Chief Executive Officer of the Health Data Consortium. You guys have seen a lot from Chris, and he's here to talk about the HDC. One thing I do want to say, thank you. After I issued the challenge this morning, these guys graciously set up an email address. It's vaxdata, V-A-X-D-A-T-A, at healthdataconsortium.org. So if you're interested in participating in this, if you have some ideas, email that address and we'll start to collate everything and go from there. So Chris, welcome.
Thank you, sir. Are you still with me? All right. Over the course of the past 3 days at Health Datapalooza 2015, we've seen and experienced the technological and research advances that are transforming health and healthcare today. And we've also stood shoulder to shoulder with the innovators and investors who are launching the next generation of apps and other breakthroughs that will turn possibilities into realities. There are many reasons why I want the world to unleash the power of health data. And you're here today because you all see the promise of data to improve access, identify gaps in care, reduce cost and waste, and more. Let me tell you my personal story. I grew up in the Oak Cliff neighborhood of Dallas, which is similar to the south side of Chicago. Our focus as kids wasn't where to play, it was how to survive. Oak Cliff is what we call a food desert. Affordable and nutritious foods were hard to find. The schools were substandard, and there was no access to health care. During that time, my mother battled lupus and other ailments. And it was a struggle to find any care for her, let alone the right care. In the Oak Cliff area, there was only one hospital servicing a community of more than 200,000 people. Despite all this, my mom was one of the lucky ones. She had access to insurance. But even with that insurance, she was constantly being prescribed things she didn't need, having tests she didn't need, and experiencing a lack of coordinated care. One time she had a terrible pain in her legs. She went to her doctor and was prescribed pain medications. She woke up again in the middle of the night with severe chest and back pains. It turns out that pain was due to a blood clot that had now moved to her lungs. She was checked into a hospital and put on blood thinners. After being discharged, she went home, but the blood clot had never dissipated. It moved to her brain, causing a stroke at the tender age of 45. She was urgently checked into a different hospital, but her medical records didn't follow her. She was the only one who knew what tests had been run, what medication she had been on, but she couldn't talk. This was merely 11 years ago. Not necessarily a lifetime ago, but only 11 years ago. I say this to say, we've made progress, but there's still a long ways to go. It's hard to create a healthy life when you cannot safely leave your house and walk around your neighborhood. These are the challenges I faced. These are the challenges faced by my family and my friends alike. This is exactly why I went into healthcare. I wanted to go into a space where I could change things, but for the average person and for the next Chris to be born in Oak Cliff. I wanted to make a difference for the 19 million Americans serviced through HRSA-funded health centers, just like I was as a child. I wanted to make a difference for the more than 45 million Americans living in poverty, which is for a family of four, just $23,000 a year. How many more Americans are right above that threshold? I wanted to make a difference for the 56 million Americans who, just like my mom, have adequate access to a primary care physician. This is why I'm here today. and part of this movement. I know we can make a difference for these Americans and so many more. And we can do it all with data. As you can see, and as you can feel from the energy in this room, the health data movement has accomplished a lot, but there's still more to do. The movement is growing. Started 6 years ago with 45 people, now more than 1,500 people as represented in this room today. Thank you. Up until this point, I've heard a lot of people talking about health data as patient-centered. But I think there is room for us to do better. I think we can put the patients at the center of our conversation, the center of our work, and truly spark a health data movement. This is our opportunity. We need to liberate data. We need to make data accessible and actionable. I assume that everybody here today agrees with pretty much these three things. But to make health data a reality, to make these changes a reality, we also need to support a cultural movement around health data. We can change the culture around data to make it more patient-centered. Why do we need open health data? It's a question I get all the time. There has been progress, but we all want things to move faster. We cannot settle. We are talking about people's health. We're talking about their lives. People want their data liberated to improve and potentially save their lives. Pulitzer Prize-winning reporter Laurie Becklin penned an op-ed titled, "As I Lay Dying." Laurie was dying of metastatic breast cancer, and in one of her last acts, she demanded and pled for the creation of a database to capture results from clinical trials, so that we could, in her words, all learn from patient experiences and make more educated decisions on what treatments will extend and improve lives. Laurie knew what we know, and she used her final words to tell the world. We need open, accessible, and usable data. Data doesn't work if you cannot use it. We need to put data to work, and the first step is making sure innovators and entrepreneurs have access to that data. The impact of what we do, the impact of open data is real if we make data actionable. You might have seen in a recent Politico story that right here in DC, some of our poorest residents, including homeless people, have greater access to health data than those who live merely 6 miles away in one of the richest neighborhoods in the US, and that's Bethesda, Maryland. A large network of safety net clinics in DC were early EHR adopters thanks to federal funding from HRSA. And now these same doctors are calling HIT vital to their work. Clinicians are now able to track if HIV patients pick up their medications, which is an important step in medication adherence and key to controlling HIV. The system is allowing for cross-clinic collaboration and enabling records to travel with patients. Something out of the question when you consider paper records. And the patients are also part of the process, with access to their data provided at computers available at the clinics or through their smartphones, which many patients own. The implications of this type of coordinated, patient-centered care are many. Not only are clinicians able to eliminate duplicative tests as patients travel throughout the city, they have also been able to use EHRs to follow up with patients. Consequently, colon cancer screening rates went from 47% to 55% within a few months and continue to rise. The national average is 54%. The data only works if you can use it. So many of those needs we've discussed this week, from policy changes to consumer education to protecting privacy, can be summed up by saying this: to see health data achieve its truest potential, we must realize and embrace this as a movement. This is more than a policy issue. This is more than a business issue. This is a movement that can improve health. This can change lives. This can save lives. Movements, power, and cultural change are a part of who we are as Americans. They reflect our shared beliefs and reflect what we truly care about. Throughout our history, we have answered the call to great challenges and societal needs by making changes to our policy, our education, and our thinking in order to change our culture. And this isn't only a call to action for us as individuals. In my mind, businesses are equally important participants in the movement too. Taking action helps organizations attain a higher sense of purpose and even realign with their mission and core values of making a positive impact on the world. We can shift our focus from talking about ourselves and our products to joining the conversation about what people already believe and care about. People care about and are talking about things like reinventing themselves, solving social problems, preventing, treating, and curing disease. We can connect with our audiences and drive a movement by being a part of those conversations. There are big cultural movements we can all reference: Civil rights movement, and more recently, the Arab Spring and Occupy Wall Street. But there are smaller movements happening as well. And we're hearing the call for a movement in health data today. People like Lori Becklin, Dave DeBrunkart, better known as ePatient Dave, and Casey Quinlan, who is here with us at Health Datapalooza, are just a few of the people, please. Are just a few of the people calling for access to health data and calling for a movement. The potential for the health data movement to change our health and society is greater than we can imagine. Let's go back to why I got into healthcare. My desire to help the next Chris born in Oak Cliff, let's call him Chris 2025. My vision for Chris 2025 is a simple one. A vision that in his world, his access to information isn't determined by his income. The treatment decisions for him and his family are driven by value, not cost. His family, his community have access to healthcare and their own data. Because where there is data, there is better health. In the end, data helps us get to a place where we're focused on prevention and not pills. We need to make this vision a reality. We can build healthier communities with data. This is our purpose. This is why we gather here. We see the better future. So how are you going to help us spark this movement? How are you going to be part of that conversation? It's happening at all levels. At the group level, the Cajun Code Fest is an annual health coding competition, bringing awareness to the movement while also making a path for real solutions to be created. At the individual level, I Conquer MS, which I hope you were able to see their panel yesterday afternoon, is providing a platform for MS patients to not only share their data, but to dictate what research is conducted with their data in a patient-governed model. And the government sees the promise too. $5 million in government funding is being invested to create interoperability standards and the secure exchange of data across systems through the Precision Medicine Initiative. You don't need millions of dollars to do your part. We can do this together. So I ask you, what role will you play in helping to spark this movement? You are the ambassadors. You can demystify health data. It's our responsibility as the experts to do that. You can help educate and spread the word through simple storytelling. You can share the success stories. You can share the promise of health data. And you can even share what you are doing personally to make this a reality. Let me tell you what I'm doing. I have committed, along with others, to collect 1 million signatures on getmyhealthdata.org. It's a petition to show the consumer demand and strength of numbers of individuals who simply want access to their electronic health records. Health Data Consortium is committed to pushing policymakers to think differently, committed to connecting with organizations around the country with boots on the ground to activate this change at the local level, to ensuring the patient perspective is heard through our consumer circle, and to connecting, showcasing, and promoting what you, the innovators, are doing. And to do that, to keep this movement going together, we need you to join us. We need to hear from you. Tell us what you have done or are doing to help spark this movement. Make a pledge for what you will do. Tweet your stories to #HealthDataPledge. Email us at mypledge@healthdataconsortium.org. We're collecting these stories to show the strength of our movement and to share how health data can and is changing the health of our nation. No movement is powered by a single person or organization. We can only do this together. Join me today. Let's put data to work and change our world together. Thank you very much.
Great, man. Really good. Wow. Chris told me he was going to get personal with that one. That was pretty awesome. Can we give Chris a huge round of applause again? That was fantastic. Thank you.